I feel like it just gave me a lot more support, especially in the times of like COVID and stuff like that, where you're kind of like isolated and can't really have all your family there. So it was great to just have someone support there who just cares about like what's most important to you and making sure you're okay. That would be the main thing that I felt with having a doula, is just feeling like supported. Um, I pretty much went to the hospital. It was like maybe around 2 in the morning, and when I called my doula and let her know, like she just dropped everything. And when I called Nakomi and let her know, she literally dropped everything in the middle of the night, put on her hoodie, and was on her way to me, and was there in just like under an hour. So I thought that was amazing. I felt really important. I felt the dedication and everything like that. So that was huge for me. And then just having her there with me throughout the whole process, from laboring, birthing, after, it was just an amazing experience. One of the main things I liked is just like help with pain management and things like that. Getting massages and pressure and trying the ball and the birthing ball and everything like that was pretty helpful.
That's awesome. Thank you. Thank you for being a part of Frontline Doulas and, letting us support you and allowing to make a difference.
Absolutely. And I thank you guys as well for allowing me to be a part of it. I 100% recommend a doula, 5 stars. Get Nakomi as your doula.
Thank you.
I just wanted to say thank you to Frontline Doulas. Truly grateful for the experience, and a special thank you to my doula, Nakomi.
Well, good afternoon, everyone. Good afternoon and welcome. This is the Black Doula Consortium's 3rd webinar. We appreciate that you can join us again and set aside some time to watch this webinar and think with us about some of the important public health concerns impacting the pregnancy, birth, and health outcomes of Black mamas and babies in our entire Black communities in California. I'd like to introduce myself. My name is Adjua Jones. I am a Black Doula Consortium partner. I am today's host and facilitator, a public health professional, maternal and infant health advocate, a mother, daughter, sister, mentor, and friend. So you can always find me doing work within my community to advocate for equity in healthcare and services for many underserved people locally, statewide, and nationally. As we started, as you saw, we showed you a very brief video, which we wanted to start with to give you a very enlightening and open and honest, transparent testimony from a mom who was supported by one of our consortium partners, the Frontline Doulas. As we discuss topics such as today's topic, we want to emphasize the fact that doulas are a promising and very integral part of the solution for our persistent Black maternal health crisis. Doulas support birthing persons all along their pregnancy journey, provide physical, educational, and emotional support, all of which are essential to the discussion we will be having today. And so if you have not learned yet about a doula, I encourage you to learn more about doulas, find out how you can support, especially the Black maternal health workforce and doulas that are working to serve and decrease the high rates of mortality and morbidity in our communities. Further, just like in the past 2 sessions of one we hosted in June and July, today we are discussing an extremely important topic. This webinar today and our guest speakers will be focusing on mental health support providers and resources available for expecting and pregnant Black mothers and birthing persons in California. You will hear from our speakers about the problem, and they will talk about research, warning signs, stigmas, and misconceptions, barriers to seeking services, as well as available programs, screening tools, assessment, and care that can be provided. For those of you who have not seen our previous events, we want you to just give you a very brief introduction of who we are and what we're trying to do with this Black Doula Consortium. So in June, with the support of the Center at the Sierra Health Foundation, Black Wellness and Prosperity Center, who are consortium partners, as well as the Center, Blue Shield, BCLC, and 2 other partners, Frontline Doulas and myself, the Frontline Doulas and Diversity Uplift Inc., and myself, Adjoa Jones, launched a new initiative which is called the Black Doula Consortium. The Black Doula Consortium is led by the Black Wellness and Prosperity Center. BWPC is the acronym, and is located in Fresno County. It is the first CBO focusing on the unmet needs of Black women and babies. The BWPC is founded by Shantae Davies Bouch, who is a public health strategist, deeply involved in our community, a colleague and sister friend of mine, who I'm happy and pleased to work with. BWPC is a catalyst to improve the well-being and prosperity in the Black community, and they strive to give all women, birthing persons, babies, and families in Fresno real equal opportunities to thrive. The partners all work in the field of maternal health and are advocating for the interests of Black mothers, birthing persons, and babies. The Black Doula Consortium focuses on 1, coalition building, first of all, among maternal health advocates and amplifying their voices. 2, increasing and widening awareness and understanding of the various factors, solutions, practices, public health decisions that may impact Black maternal health outcomes. So we have planned 7 webinars and events between June and December 2021. The consortium has a shared vision, which is basically and primarily, and our bottom line, is to curb preventable deaths of Black infants and their mothers and birthing persons, which is critical. So just want to make sure we can emphasize that. So working alongside with the partners on these objectives, we prioritize issues that greatly shape our community's lives. We invite prominent BIPOC folks, so that's Black, Indigenous, people of color, and people of color, Black maternal experts. Our past 2 webinars were about doulas and the work that they're doing. That webinar was entitled Understanding and Reimagining the Black Maternal Health, and it took place in June. Our second webinar was about 2 legislations that are great steps towards equity for Black women and birthing persons. This webinar was titled Groundwork for Person-Centered Care, and that one was focused on SB 65, which is the California Omnibus, which is right now still being decided upon. So if you can, continue to lend your support towards that. And SB 464, which was the Pregnancy and Dignity in Childbirth Act, which was passed in October 2019. And that webinar occurred last month. This August's webinar today is on, all of those, will be found on BCLC's website. Nope. No, we're going to have to scratch that. Will be found on BCLC's YouTube channel and on the social media pages. If you visit BWPC's website, you will find the BDC, Black Doula Consortium. I'm giving you all these acronyms. One pager that you can that will give you additional information about our work, also how you can contact us and tap in, and you will find this link also in the description. So again, I really want to emphasize that we are really interested in engaging with our audiences on these topics, so we can learn more about your realities and understand your questions. Every event of ours includes a community engagement element, whether or not the event is live or pre-recorded. These community engagement surveys are still open, and we would be honored to hear your voices. So please tap in. It is critical to the work that we do that we always hear back from our community, and we're able to even create more programming, more strategies, more resources when you're able to participate and tap in and be fully engaged. One of them is aimed to collect your birth and pregnancy experiences. So Black women, birthing persons, please share those. Even dads, that would be critical to share those stories. And the other is specifically asking you about your views, feelings, hopes regarding SB 65 and SB 464, and the ways in which you believe they would help you as a Black woman or birthing person. So again, the past surveys are still open for the pregnancy and birth stories, as well as those on current legislation. If you have some time, please follow the links in the description. Tell us about your feelings and experiences. After this background information, we are turning back to today's topic, which is again, Black maternal mental health. As our main profile is improving the health outcomes for mortality and morbidity rates in Black mamas, birthing persons, and infants, we can't skip a discussion about maternal, prenatal, and postpartum mental health, which we know is very critical, especially in this time, as we're still in a pandemic, as we see cases rising due to the Delta variant, as we have experienced and see and have more and more data is being collected about the impact of the pandemic on pregnant and parenting moms and their families, and just overall our entire nation and world, what it has done to our mental health. So we really want to clue in and be gain more knowledge, awareness, and provide education around what is maternal mental health, what is postpartum mental health, and what are potentially some of the issues and services and what can be done to help support. So we know this affects our community, but we also know that many women do not receive the appropriate treatment because their problems go undetected or they go unvoiced because they are afraid to share. For discussing this topic, we have invited two excellent experts, Anna King and Dr. Alexandra Addo-Boateng. I want to make sure I get it right. And if not correct, and then let me know, because I had that experience all of my life. Who will provide you with a brief presentation, then that will address and some of your targeted questions about this issue. We want to make sure you address any questions you may have about this issue to our speakers. So we'll bring those up so that you can also get your questions answered by the speakers. And as we said before, within our work, we want to amplify your voices and understand better your realities. So for this topic, we also have a community engagement element, as I mentioned earlier. We know it can be hard, but if you're ready to speak up, please, we will be very honored to hear your voice, to know what you're experiencing. What are your greatest worries regarding pregnancy, labor, and taking your baby home? Are you having challenges with coping? Do you have the support you need? Are you fearful of telling someone about some of your mental health experiences or some things that are happening to you or have happened after you have had your baby? Do you have feelings of detachment? These are things that are critical in the work that we're doing, and we do not want to be involved in the victim blaming and shaming, but we do want to be able to properly serve our community and get folks to get our pregnant moms, babies, and their families the help that's serving you better. You'll find a link in the description, Black Women About Maternal Mental Health and Real Life Stories. So our first speaker for today is Miss Anna King from Maternal Mental Health Now. Anna King is a licensed clinical social worker and certified perinatal mental health specialist who uses an integrative, trauma-informed approach in her work, grounded in reproductive and transformative justice. She is currently a part-time psychotherapist with ARC Counseling and Wellness and is a PhD student in the Integral and Transpersonal Psychology program at the California Institute of Integral Studies. Her research interests include spiritual activism, the highly sensitive person trait, birth and postpartum tradition, and the transition to parenthood as a rite of passage. Anna also currently serves as a clinical training specialist with Maternal Mental Health Now, which is where we met, where she curates training events and curriculum and facilitates live and online training to educate providers on perinatal mood and anxiety disorders. Acronym for that is PMADS. You must attend one of her trainings. I tell you, it is really, really helpful. They did a Black Birth Workers series, and I thoroughly enjoyed it and learned a lot. Prior to joining Maternal Mental Health Now, Anna served as a full-time social worker in the emergency department and eventually found her home in serving the perinatal community when she transitioned to serving in the neonatal intensive care unit and birth center of Epigenetics Health. Is that right? You'll correct me. She developed a passion for supporting the unique needs of parents in their transition through pregnancy, childbirth, and postpartum. Throughout her experiences, Anna has realized the significant barriers to care for birthing people, especially for Black, Indigenous, and people of color, and queer, trans, and gender diverse individuals. Her work centers the liberation of marginalized groups in reproductive spaces. Can you join me in welcoming Anna, and thank you for accepting our invitation?
Thank you so much, Adjoa, for your kind words and awesome introduction. I'm going to go ahead and share my slides here, and the correction is emanate. And it's funny, whenever they were changing the name a few years ago, I think everybody was like, wait, how are you actually supposed to pronounce this? And nobody knows.
Yeah, looking at it, you wouldn't, but I got it now. Thank you.
Turns out it's emanate.
Emanate.
So let's see here. Let me just make sure I can go back and forth. There we go. So I'm just really grateful to be here to share with you some information. It's definitely a topic that's so important, and it's always amazing to hear about new organizations that are doing work in this area. So I'm just going to give you a little bit of background about Maternal Mental Health Now. It originally started in 2007, I believe. I believe we're coming up on our 15-year anniversary. There was an individual, Kimberly Wong, who's an attorney, and it was experiencing significant postpartum depression to the point where she developed some suicidal thoughts. And she had a lot of trouble finding resources. And so she thought, if I'm having this much trouble finding, appropriate care, imagine what that's like for everyone else. And so she got together a group of stakeholders, people who were doing work in the community, and started having conversations. And then the organization developed out of that. And speaking of name changes, the name of our organization used to be the Los Angeles County Perinatal Mental Health Task Force. And that's a bit of a mouthful. And so the name changed about 5 or 6 years ago to Maternal Mental Health Now. And we were really encompassing of 3 different legs of our organization. We focus on reducing stigma and raising awareness around perinatal mental health. We offer training, and I'll cover a little bit more about this later in the presentation, specifically what we offer. And we really work to do work in policy, advocacy, and legislation around perinatal mental health. We don't provide direct services. We did in the last year offer a support group as a result of a contract we had, but that's not typically our area. Our area is really bringing trainings like this to the community. And so to just kind of situate the issue a little bit more, if we're thinking about some of the myths and stigmas that our parents face going into the perinatal period, there are really a lot of them. There's this idea that pregnancy and parenting is easy, instinctive, intuitive, and that, there's this glow that you get. And when any of these things don't happen, which I would imagine for a lot of us, it didn't happen for me, then it can really bring about a conflict there. And so there's this idea and feedback and messages that our families get that, good parents don't get depressed. So there's this real joining of your quality as a parent paired with your mental health. And people get messages like, how can you be depressed if you're having a baby? Or, but you have such a beautiful baby. How can you not be so happy? And so this can really serve as a barrier for a lot of our families with getting the support that they need if they do find that they're struggling. And for many of them, they may feel, if I tell you what I'm really feeling, they have fear of being judged, that someone's going to call them or think that they're crazy, that Child Protective Services might be involved. And a lot of us have been hearing about the story of the medical kidnapping in the state of Florida. I can't comment on the details of the case because I don't know the specifics in terms of the Child Protective Services case, but what we do know is that this kind of story is not unfamiliar for the Black community. There's a real history of this kind of thing happening frequently, and so those fears and concerns are very real. And for some of our families who, have differing, immigration and citizenship status, there's a fear of deportation. And so at the core of it, these are actually, there's some validity to some of these concerns. And so if we're thinking about what our families are facing, we can better understand what their needs are. And so let's see here, let me get to my next slide here. When we talk about perinatal mental health, it's really, we're really honing in on a particular period of time. So we're looking at preconception, and that really includes that fertility journey. So people who are thinking about becoming pregnant are included in this period. And then once they become pregnant, and that period of time gestating the baby before birth, and then leading into the postpartum period. And we say that perinatal mental health conditions can really emerge anytime in that first year after birth. And so we're really looking at extending care and really looking at and providing that support beyond just those first few weeks after birth. And so in the state of California, Audra already touched on some of these points, so I won't belabor them too much. But if we think about the number of babies that are born in the state of California is right around roughly 500,000, and only 5% of those babies are Black. In the state of California, 1 in 5 birthing people experience some form or symptoms of prenatal and postpartum depression, and that's either detected or undetected. But for Black birthing people, those numbers go way up to 1 in 3. And so what the statistics have found, there's been a lot of studies done over the years. Some of them are done every few years. And in between. But what they found is really supporting this idea that populations impacted by issues of race, poverty, and other social factors experience an increased frequency and severity of mental health conditions, especially in that perinatal period. And so there's this inverse relationship between income. So the lower the income and depression, the higher the rates of depression. And the highest rates have been found in Black and monolingual Spanish-speaking women and birthing people. And so some studies have found it's right around 38%. And so what are the implications of this? And it's really unfortunate that it takes having to calculate these numbers to kind of drive home this point. But the reality is that perinatal mental health issues that are undetected, unrecognized, untreated are expensive. It creates a burden and a cost on our system. And so the numbers are right around $32,000 per person, totaling $2.5 billion in California. And nationally, just to compare, those numbers are right around $14.2 billion every year as of 2017. But what it really boils down to is really this loss of income and productivity. Many of these parents have trouble going back to work, or they go back to work and have to take off. Many of them are experiencing poor health outcomes, and we know that for Black women and birthing people, those outcomes are very significant. And so that places a more cost on the medical system. And so we know that of those 1 in 3 people who experience some symptoms of depression, only half of them are receiving any kind of care. And so this is why it's so important to be addressing these issues. So what are some of the risk factors? We don't have enough time to dive into all of this today, but I wanted to put kind of some of the more frequently identified ones here. I won't read them all, but I want to point out that the one of the biggest ones is sleep deprivation. And so we know in the perinatal period, people aren't getting a lot of sleep. So when we're really thinking about supporting our families, supporting good sleep hygiene and increasing support so that the person can get adequate sleep can really go a long way. And we're thinking about families and connecting them to support. Oftentimes therapy isn't necessarily always the first line of defense, right? And so you want to think about what are some of the other opportunities to increase and support their health that isn't necessarily this mainstream way of addressing it. So when we go down the list here, we're of course, personal and family history of depression or anxiety, and folks who have a history of or know that they have sensitivity around their hormone fluctuations might be at a higher risk. Of course, financial strains, isolation, which we've seen so much more of during the pandemic. And then you'll see, experiences of trauma, abuse, or harm. And so that includes racism, and that includes the racism experienced by the medical system. And so we know that that's a reality for our Black families, that oftentimes they experience a higher rate of that. And that leads to an increase of toxic stress, and then impacts their mental and physical wellness. And so many of them may experience barriers to access to timely and appropriate care. They may be coerced to do things that they don't necessarily feel aligned with. And for many of our families, especially those who don't identify as woman or female or mother, and may experience harm in terms of their gender identity, that's a very real experience too. So when we're really thinking about an intersectional approach, we have to think about these issues. And so for our Black and queer families, those risk factors are much greater. And so you can kind of read through the rest of those there. And so this is just a list of groups that are at the highest risk. I'm sure none of them surprise you much. Teens, military families, of course, trans and non-binary birthing individuals, Black, Indigenous, Latinx, recent immigrants, socially isolated families, and single parents. And so a lot of these families are the folks who are walking through our doors. And so when we're thinking about the risk of perinatal mood and anxiety disorders, oftentimes these families may end up needing that care. And so again, we don't have enough time to go into the detail of this, but I wanted to at least lay it out of what it is that we're actually talking about when we talk about perinatal mood and anxiety disorders. And the first distinction is really that it's not the baby blues. The baby blues is really a direct result of that transition from being pregnant to being in the postpartum period. And it's a result of that sleep deprivation and hormone fluctuation. But typically it's mild, it goes away on its own after 2 weeks. People are still able to access some moments of, contentment and ability to access some joy in their emotions. It's not at all the same thing as postpartum depression. And if anything beyond 2 weeks, it's no longer the baby blues. And so, I've heard stories of patients who went to go see their primary care doctor months after they gave birth, tell their doctor how they're feeling, that they've been feeling so depressed and not able to get up and do everything they need to do each day. And the doctor dismisses it and says, oh, it's just the baby blues. And so we have to really be careful about that distinction. Other diagnoses that come up are depression, anxiety. Underneath that umbrella is panic disorder, obsessive compulsive disorder, which really encompasses intrusive thoughts, bipolar disorder, which can serve as a risk factor for the development of postpartum psychosis, as well as post-traumatic stress disorder, which is oftentimes childbirth related. And so, if you want more training about that, we have a lot of opportunities for you to learn more about those diagnoses. But what I really wanted to kind of share with you a little piece of knowledge about postpartum depression is that oftentimes there's language you'll hear that might clue you into someone who is struggling. They may not walk in and say, I have postpartum depression, or I am experiencing depression. You might hear them say, I've made a terrible mistake. And they talking about their decision to have a baby, and they may be showing you clues that they're having some anxiety. They might be saying, I'm all alone and no one understands, and that might clue you into some feelings of isolation and withdrawal. And so you can read through the rest of these. One of the more significant ones is here at the bottom. Sometimes I think everyone would be better off without me, and that might be cluing you into suicidal thinking, and you want to do some more assessment, or if it's a peer of yours that you're hearing say that, you want to, try to help them get connected to some support to make sure that everything's okay. And so when we're thinking about wellness planning, what do we do when we identify someone, or how do we even identify someone who's struggling? Really, prevention is key. Regularly screening for perinatal mental health early and often, and really making an individualized plan, because our clients and our patients, their needs are not one size fits all. They're not cookie cutter. Everyone has different needs and will respond to a different wellness plan. And so thinking about involving support systems systems and non-gestational partners and spouses with their permission can be really powerful. And also screening that partner, because partners are at risk for developing postpartum depression and other mental health concerns as well. If breast, chest, body feeding is an issue, help relieve some of those feeding pressures, maybe normalize that it's okay to supplement, or maybe find ways to support their body feeding so that they can alleviate some of that pressure on their mental health. And just really understanding and remembering that if left untreated, the symptoms can persist and evolve into a chronic mental illness going beyond that first year after childbirth. And so a universal message, if you don't remember anything else that I shared, you're not alone, you're not to blame, and with the right help, you can get better. And this is a message that's often shared by Postpartum Support International. So just to offer up some more kind of ideas for resources and interventions, just really thinking about how to provide education and reduce that stigma, providing social support, allowing them to tell their story and be self-reflective of their experience. And that's one way that you can kind of key into what it is that they need or what their experience has been like, and how they're coping with it. Ask for and receive help. Teach them how to ask for help. For many of our families, it's not something that is a regular practice, and that could be cultural. It could be a lot of different reasons, and reasons that we identified at the beginning of our time together. Fears of what might happen. What are some of those consequences? And really considering other forms of support. Spiritual care and faith-based support is really powerful, especially in the Black community. And really connecting with them to identify if there are any rituals that they want to engage in that perinatal period. Helping them get access to healthcare and listening to their feelings. Don't dismiss them. If someone is saying that they are struggling, believe them. And so here at Maternal Mental Health Now, we offer a range of different kinds of trainings personalized to your needs, live, virtual, in person, on perinatal mood and anxiety disorders, scope of impact, screening and assessment, approaches to trauma-informed care in the reproductive space. We offer self-paced online trainings, which I'll share a flyer in just a moment on what some of our offerings are in that area. We offer webinars and workshops. We're working on a really exciting webinar series for 2022. We offer conferences. We have a community resource directory, and we offer a monthly consultation group that is free and multidisciplinary for any provider who has been trained in the basics of maternal mental health. And we've just recently been approved as a continuing education provider through the American Psychological Association, and we're available for co-sponsorship if that's something that you are interested in. So this is just a variety of courses we have available. We just recently added a couple of courses titled Psychopharmacology and Perinatal Mental Health, as well as It Takes a Village, creating a perinatal mental health support group. We offer a certificate training that counts towards the PMHC credential through Postpartum Support International. We're not part of that credentialing process, but we created this training and got that approved by PSI to serve as a basic certificate training in maternal mental health. So if that's something you're interested in, we offer CEs and CMEs for most of the advanced courses, not for the certificate, but for the advanced courses. So that's available. These are just some of the webinars that we've had this year. We have one left titled Increasing Accessibility, Mastering Insurance for Maternal Mental Health Professional. And we're working on one next year that continues this idea of complementary and alternative interventions for perinatal mental health. Adjoa mentioned earlier that we really hosted an amazing conference back in April and May, titled the 2021 Perinatal Mental Health Conference for Black birth workers, clinicians, and providers. We covered a range of topics: perinatal loss, decolonizing mental health, trauma-informed care, and overall supporting Black maternal mental health. And so the recording is available for that for a few more months. It's $199 for the whole conference, or we have scholarships available for BIPOC providers to access the recording for $50. We also hosted, we were a little busy, we had a second conference right following the Black Birth Workers Conference titled Legal and Ethical Dilemmas in Perinatal Mental Health. And so for those who require law and ethics CEs, that counts toward that and is available for $100 for all three webinars, $40 each. We covered child welfare and perinatal mental health, criminal justice system and psychosis, and perinatal mental health, as well as decolonizing the mental health care system and reproductive care. We have brochures available. They're available in the 7 most commonly spoken languages in Los Angeles County. They're available for download. We have a resource directory. It's for now, it's based in Los Angeles, but there's a lot of really great resources and opportunities to find a provider who provides care in the maternal mental health space. We added a function that identifies telehealth services, and we're currently in the process of revamping it and coming up with an entirely new platform that we're really excited about that's specific to mental health resources. But for now, this is still a really great resource to use. We have a web-based app that's titled the Emotional Wellness Self-Help Tool. And it's a great to really take you through a series of exercises to identify areas of challenge with your mental health. There's practices for stress reduction and relaxation. And it ends with a individualized care plan that you can save and share with your provider, or just use to continue to check in on yourself and communicate what your needs are, give you some language around what those are. Postpartum Support International, I've mentioned already, but they have a range of resources. They have their own resource directory for mental health resources, lots of education, lots of groups. There's one specifically titled the Black Mamas Matter group, and there's a group for queer parents as well as their helpline, which is listed here in this photograph, that parents can utilize to get some immediate support and connection to resources. I wanted to share this resources, which is really important in the event that a pregnancy results in loss. This resource, Sisters in Loss, is specific to, it's a community of Black women replacing silence with storytelling. And so it's a direct support for Black families who have experienced loss in the perinatal period. Another similar organization, it's not Black owned, but still offers a range of really helpful resources regarding loss, is Return to Zero. There's groups, education, and such. Other just resources to know about, we have personal stories that we capture often. We really value storytelling in our work, and so you can go look at those on our website. And if you want to follow us on Facebook or Instagram and stay in contact. And thank you for allowing me to come and share this information with you.
Well, no, thank you, Anna. That was amazing, Anna King, soon to be Dr. King. You shared a lot of information, a lot of key critical information in such a short time. At one point I said, oh, I'm going to have to take a breath for Anna, because you were pouring out those resources at the end. So we definitely want to make sure that we have those resources available that you share, because I believe they're really important. And it is really incumbent upon our community, as you stated, to really get involved in some of these resources available, really access the care and services. So I'm so grateful for you providing us with that overview, especially details on signs that we should look out for, how we should destigmatize, and how those stigmas are, are being put out there, and how, they impact the health and wellness, especially the mental health of moms, especially when you say, oh, the baby blues and the period is well beyond the time where it's baby blues, and that is very critical. So again, this is an opportunity. Again, thank you, Anna. We'll come back with questions, but remember, community is your opportunity to get engaged, to ask some questions, especially if you are a woman or birthing person that is experiencing any type of postpartum or mental health, or concerns about your mental health. If you're hearing voices, if you're, challenged or feeling like disconnected from your infant, if you're feeling like you're not supported and could just use even someone to talk to, we have support groups and services that are available in our community, and even the doulas. Most of the doulas, doulas serve various aspects of the birthing and pregnancy experience, but there are some that are just postpartum doulas. So you can even have someone that is totally focused on that work and support for you. And so we do not want you to be out here alone and feel like you don't have anyone to help. Please call out, and please ensure that you are taken care of as well, so that we can get you and your infant and family the support that you need. So again, thank you, and we'll be back with questions for you. Anna. Dr. Alexandra, our next speaker coming up is Dr. Alexandra. And I want to make sure I'm saying your name right. So you're going to have to come off of mute because, we can do interactive conversation.
So it's Audubonton.
Audubonton.
Mm-hmm.
Oh, Audubonton. I'm going to learn this. Okay, thank you, Dr. Alexandra Audubonton.
Mm-hmm.
Okay. Received her doctoral degree in education, counseling, psychology, and has a master's in marriage family counseling. She teaches psychology courses at Fresno Pacific University and sits as the board president of NAMI and board member of Neighborhood Industries. I'm familiar with NAMI locally, so great. That's good to hear. Dr. Adewanton serves on several patient-driven projects, thus encompassing complex case management and perinatal wellness. She provides individual and couples therapy addressing perinatal health outcomes, preterm birth, traumatic birthing experiences while addressing childhood trauma that has resurfaced during the perinatal phase. As the Director of Perinatal Mental Health Services, her area of expertise is educating medical providers and stakeholders on integrated program development, multi-generational impact of perinatal mental health disparities, social and cultural implications, diagnosis, and treatment. Dr. Alexandra oversees several county-level perinatal women wellness coalitions throughout California, including a statewide collaborative, the Maternal Wellness Collaborative of California. Throughout collaborative efforts, she continues to focus on systems change and policy development. Thank you so much, Dr. Alexandra, for accepting our invitation and talk to us and share with us from a provider perspective.
Thank you. So our first couple of slides we're going to go through pretty quickly because Ms. King has kind of highlighted that. But our agenda today is perinatal wellness, the research and data behind it, the screening tools, protocols, and resources. Turn the slide. So I'm not going to go in depth of perinatal mood and anxiety disorders, but what I do often like to explain is a lot of times people will think of postpartum depression. So we really want to emphasize today that it can happen during pregnancy and after pregnancy. We say up to 2 years. And when you think of postpartum depression, you just think of a mood disorder of sadness and depression. But it's actually a variety of symptoms. So it could be anger, anxiety, panic attacks, irritability. So it's a list of disorders. Next slide, please. So it can, again, once occur from the moment of conception up to the baby's second birthday. And the reason why we say this is, and I'll show you later on in the slides, our hormones make a shift, whether it's, from the moment of delivery or after decreasing breastfeeding. Next slide. So women of color, African American mommies, are at a twice higher rate than Caucasian women to experience this disorder. 38% of new mothers experience this complication of depression and anxiety, and that's similar to what I had said before. Now, there's different theories that we'll discuss later on in the presentation, but for the most part, it's your hormones, right? So from the moment of conception, your progesterone and estrogen increase, and the moment of a delivery, it plummets. I love this slide because it kind of, shows moms that it's our hormones, right? So it's not that, that things are just not going well. It could just be a hormonal piece. And so I really like to highlight that component of perinatal mood and anxiety disorders. So it's a health disparity that, there's no socioeconomic status, no age. It can just happen, right? Obviously, in our moms of color, it's a higher prevalency rate, but there is no rhyme or reason. And the other piece that I like to highlight is maybe you had a great pregnancy, your first pregnancy, second pregnancy, and then when you hit your third pregnancy, you have a horrible perinatal mood and anxiety disorder that you're experiencing. let's say that you have a great first pregnancy, second pregnancy, and you have perinatal mood anxiety, third pregnancy, but maybe your fourth pregnancy is smooth. So again, there's no rhyme or reason, it just can happen. So women of color are 2 to 3 times more likely to die during pregnancy. And so when we talked about some of the systems change pieces, that's kind of what we work on the Health Collaborative, is how do we get hospitals to really recognize maternal health overall in regards to African American mommies and mommies in general? What kind of systems do we need to change? How do we get different departments to communicate with each other? How do we put protocols in place where moms are screened? The research component is that 60% of women of color do not receive treatment or supportive services. The reason, it could be lack of insurance, it could be lack of awareness, it could just be culturally inappropriate care on the part of the provider, the OB, the pediatrician, whomever. And so that's again some of the pieces that we work on at the collaborative. Next slide, please. So this is another lens of perinatal mood anxiety disorders, and we're also going to talk about ACE, but epigenetics. So epigenetics is a newer theory. It discusses how your cells are either turned on or turned off, and how the moment of conception, maybe these cells are being activated by your hormone switch, which then can lead to, again, a perinatal mood anxiety disorder. It's a newer concept. There's less data on it. So, we really want to dive deeper into it, but I always want to bring it up because, again, you could have a setting where you have a planned pregnancy, everything's in place, you have a great support system, but again, you find yourself very stressed, falling in a deep depression. So there is some research looking at the epigenetic component. So why is this important? The stress, the depression, there's a component of telomeres, which is a piece of our cells. When we're stressed, what happens is the telomere actually shrinks. And so we go back to the epigenetics. Is it then that we as women of color have been under loads of stress throughout generations that then impacts our telomeres? Next slide, please. Okay, now this is really important in regards to perinatal distress. So what we have now learned with epigenetics, telomeres, and those components is that cortisol is expressed when a mom or any human is under a lot of stress, right? And so why is this important? Is it actually crosses the placenta barrier wall that then impacts the fetus, okay? And there's sensitive periods within our pregnancy that we don't want to undergo a lot of stress because it can have an impact on the brain and the fetal development. It says cortisol exposed is linked to stress and anxiety. It impacts the infant's overall behavior upon delivery. It's the kind of the programming of the brain of the fetus from conception, right, until the moment that the baby is delivered. So again, that's why the maternal mental health component is such a vital component, because A, it kind of sets the template of the baby's behavior, and two, it also impacts the baby or fetus's immune system. Okay, next slide. So early stress and trauma has been linked to a person's overall medical history, right? Their immune system, levels of inflammation. Now, if we want to go back to the epigenetics, we want to go back to the stress during pregnancy, crossing the placenta barrier wall. Again, this infant is then being bombarded by cortisol, which then can cause asthma with inflammation, can cause all these health outcomes that we just don't want our babies to have. Okay, another component of early stress. Now, when we think of early stress, remember this baby's still in utero. So the baby can then be delivered with lower birth weight because of decreased blood flow to the placenta. There are increased rate for miscarriage. Now we know our mommies of color are at a higher rate for preterm birth from adverse maternal health outcomes. Now I want you to kind of keep in the back of your mind the epigenetics, so the history of trauma with the African American community, and then kind of link it back to miscarriages and gestational diabetes. These are all components that kind of circle back around as a mom is pregnant. Next slide. So there's a big push right now on ACE, which is great. We all want to hear about adverse childhood experiences, but how does that kind of correlate with our moms and babies? Now it's multi-layered, but what we do want to talk about is that a mom's history of trauma, again, can impact one, the fetus development, and two, how she bonds and attaches with this new baby. We do know throughout research that boys demonstrate a greater vulnerability to stress during utero. And it kind of manifests as anxiety and depression as time prolongs, but it's really looking at the mom, what is happening internally with mom as she carries this beautiful baby and then upon delivery. So perinatal exposure of ACE, or it's the pathway of, again, the child's pathology overall, right? Because it's a template. As a baby is growing in utero, again, they're setting those neural pathways. And I always like to tell our moms, because our moms always want to get back to, basically how they were prior to pregnancy. And I like for them to look at it as you're developing a baby in utero. So you're actually growing a human in your uterus, right? And if we really kind of think about that, that takes a toll on the body overall. So by next slide, effective screening. So I hope all that made sense, and I feel like I'm going super fast in regards to the development of a baby in utero during the perinatal period. But there's a ton of effective screening tools. But before we get into the tools, we need to talk about policy, right? We need to talk about, are these screening tools being executed in a culturally competent way? How do we amplify and support moms that are being screened? Back to like kind of the ACE pieces. Right now, everybody's doing a big push on screening, but how are we doing this effectively? So I don't want us to go out and screen and not have a system in place that, one, is culturally appropriate, two, mirrors the mama's needs, and then there's a referral system, and not just a piece of paper, but a warm handoff, right? What we do know is African American women often suffer in silence, right? The one thing I will say about the pandemic, I always like to look at a positive element with any sort of adversity, is now everybody is talking about mental health and mental health outcomes. So it kind of segues to host additional conversations. Next slide. So these are our screening tools that we often embed into our OB practices, our pediatricians, our WIC offices, whoever interfaces with mom and baby, we want them to screen. It's actually a self-assessment tool, but even we have preschool screening because moms often have babies in pairs. So the patient health questionnaire, it's used for moms and dads. For this talk, we really didn't speak much about dads, but dads do also suffer from could suffer from mental health disparity during this time period. So I personally like the PHQ-9 because you can screen anybody in the room for any sort of depression. But next slide, please. There's also the Epds, which is another screening tool for pregnant or postpartum mommies. And again, we like for our providers to screen moms. And next slide. So this is kind of the screening schedule. So ideally, so one thing about moms is they might forgo their health, but oftentimes they don't forgo their baby's health. So what we like to tell providers, especially pediatricians, is if you could screen mom and dad at the same time as they are visiting their well baby visits. So every time baby comes in for a well baby check, screen mom. Host those conversations. Because what we do know is mom's health is going to directly impact the baby's health, as I mentioned prior to in utero and then after upon delivery. Mom's not going to attach with the baby. Mom's not going to interact with the baby because, as you all know, if you don't feel well, you don't want to, last thing and read to anyone for that matter. But again, that's just kind of the well baby schedule that we would like for pediatricians to mirror. And the American Academy of Pediatrics also has endorsed that schedule. Next slide. So treatment options. There are a ton of treatment options. What I do want to say first and foremost is just decreasing stigma, right? Talking to a girlfriend, creating support systems, having coffee, play groups, mom yoga, doulas, right? I'm so excited about our doula practice this last couple of years because that's what mom needs. It's just an outlet. But if we get to the PMAD piece where it's extreme anxiety, panic attacks, OCD type behaviors, we do want to see a therapist, right? So that's that talk therapy. Sometimes moms need antidepressants. Not all moms will need that. What I do tell moms, because some moms might need it, but they're not ready for that, and that's okay. It's just to establish a relationship with a psychiatrist. You can go see a psychiatrist without saying, oh, I want your medication, because it takes a while to establish that relationship. So let's say, yes, you're having panic attacks. Go see a psychiatrist. Say, you know what, I'm just establishing a relationship. That doesn't mean I want your medication right now. But if I don't feel better in 30 days, maybe we can revisit that conversation. We have found in lots of research that omega-3 vitamin Ds are also a help support depression and anxiety and support groups. I cannot say enough about that. Bible studies, any sort of interactive with other people really helps with that depression. Now we're going to talk about a self-help care plan. So next slide, please. So this is our basic self-help care plan that we have implemented throughout our programs. It's nurturing your mind and body, understanding, relaxation, spirituality, and exercise. And when we talk about exercise upon pregnancy or after delivery, it's walking around outside with the baby in a stroller. It's not going to the gym and running a marathon. That's not what we're after. We just want you to start moving your body. Next slide. This is another kind of self-help care plan. It's find your mantra, find your tribe, which again, I think that's key. Be curious. Perinatal mood anxiety disorder, there's a lot of shame around that because our society says, as Ms. King had said, we look at motherhood as the happiest time of life. And I do wish that Huggies could come up with a commercial that was more reality-based, right? Having a baby is a lot of work. It's a lot of work on your body, a lot of work on your mental health, and it's just a lot of work on the family system. So if we could be a little bit more truthful about that, I think women would speak up. And the next one is be truthful and be kind to yourself. So I oftentimes, when I have a negative thought in my mind, I think, would I say that to a girlfriend? Would I say that to a patient? How come I'm okay with this? And find meaning. So whether it should get better, help out, in a support system for moms and babies, those are all ways you can start to feel better. Next slide. So what do we do at California Health Collaborative? Again, we provide counseling, care coordination, collaboration, education awareness. We link to support groups, we host support groups. And we are really about non-traditional and traditional settings, right? You don't have to be in a counseling office, once a week for 50 minutes. There are different ways to get better, right? And whether it's going for a hike with your best friend, it's really what makes you feel better. We also find that case management and planning. So planning, how do we work on some of these components to help your family get well? That's what we do in California Health Collaborative. We are all throughout the state. Next slide. Here's some resources. Ms. King had also provided some great resources, so I don't want to kind of duplicate them, but PSI, Black Moms Matter. So here are some resources for our moms and babies, and lots of 2020 mom webinars, lots of great information. So I will say this last couple of years, I feel like we're doing a great job of collecting our resources and getting our ducks in a row for our moms and babies. Next slide. And these are our references. And I think that's it.
Thank you so much for your presentation. Thank you again for being here. Now we're just going to go into a little bit of question and answer, just a short discussion. I have like a couple open questions for you all and then some directed questions, if you don't mind. And so remember, guests or audience, although we're not live, we still want to encourage you to participate and ask questions. They're critical, even for us to give you the feedback or answers later. We want to convey all of the questions to our speakers and make sure you receive responses from them, not any that we have cultivated on our own, but from the experts and those that are doing the work around maternal mental health. So, with that in mind, what practical ways and approaches can you suggest for families and providers to encourage women to open up about their mental health?
I'll let you go first, Dr. Alexander. I know you have to go soon.
Okay, so practical ways, I would just say, really connecting, right? So I feel like, one thing that we teach at the collaborative is really connecting with your patients, right? And really come from a lens of, being a parent is hard, right? And just having honest, tough conversations versus this more authoritarian feel, right? Because I'm not going to tell you that, things are hard if you're the provider. Does that answer the question?
It does answer the question. I think one additional question I would, all right, Anna, why don't you go, and then I may have like an add-on to that.
Yeah, I mean, I agree with most of what she said, really just helping families understand that transition to parenthood is significant and more significant than, society or the media makes it seem, and that it's okay to have an adjustment period and a wide range of emotions that might emerge. And just understand that there are options, that, peer support is really effective. Parenting groups are really effective. And the more supported and better they feel, the more fully they'll be able to show up for their baby. And, we really inherently believe that every parent wants to be a good parent. It's just sometimes there's barriers that keep them from being able to be the best parent they want to be. So, just knowing that it's letting them know that it's not their fault and that there's options.
Okay. With that in mind too, I'm thinking from the family perspective, right? Because as you shared, the stigmas like, oh, it's just baby blues. Those are some things that have still been said throughout families, from, whether it's a spouse or a partner, whether it's the grandmother, the aunties, other friends or family. It's like, oh, you'll get over it. But how do we get the awareness to our village, our network, about the seriousness of this, postpartum depression, or the perinatal mood and anxiety disorder?
Yeah, and so I would say, we've started well before the pandemic. We started really reaching out to churches, grandmas, our non-traditional partners, right? So even the police department, in Madera County, if they go into a house and there's a baby or a pregnant mom, they're to give out a pamphlet. Just really spreading the word constantly about this, right? And I also want some marketing. Like if I had a magic wand, I would have a billboard of a family that's kind of in chaos, right? Because that's what reality really looks like.
Right. Right. And Anna, go ahead, because
I was just going to say also, I agree. And I would add that, part of screening is part of that ability to provide the education and start talking, having conversations about it and normalizing it. So if you remember the schedule that Dr. Alexandra presented, that's a really frequent screening schedule. And so every time that you're screening is an opportunity to educate on, what those signs are, what to look for, how are you doing, how are you coping, and really taking those opportunities to provide the language and access.
Okay. I think that's critical because it's important for others to know that, the family members, the spouses, the husbands, that if the mom is not feeling attached, if she's not feeling like she can engage, whether it's cleaning up around the house, whether it's preparing food or whatever, that it is, don't take it as, oh, she's being lazy or she's not, doing this or that you feel she should be doing. It could be more mental health related, and that's critical. Dr. Alexander, I want to ask you this really quickly. COVID and maternal mental health data, if not available yet, what does the evidence suggest? Like access to doctors in the Central Valley, or what are the proportion of Black mental health care professionals, or did we see an increase or rise in maternal mental health issues or perinatal related mental health issues?
I'm sorry, I lost you. Can you say that one more time?
COVID and maternal mental health
COVID.
data.
Oh, yes.
Yeah,
COVID.
from COVID, yeah.
So we don't have the data yet, but as you guys are all aware, the hospitals, at first they were in kind of this chaos piece, right? Of how do we protect our moms? How do we protect our babies? Right now, if dad or partner does not have the vaccination, they're not welcome into the room. There's only one person welcome into the room. So if we know that 1 in 5 women suffered from a perinatal anxiety disorder prior to COVID, I just know that we are going to have a huge mess on our hands, right? Mm-hmm. So going back to the ACE piece, is it that our babies that were born during this period and our mommies are already at a level of trauma just being born during this period? But we don't have the data to answer your question. We need to wait to see.
Okay. Do you have any recommendations for access? I know you have to go, but access during this time to get the support, especially with COVID, and even as you mentioned, not being able to be in the hospital setting, because each hospital is having different rules and regulations. Either the partner has to test or they have to be fully vaccinated. All of those things create, a level of anxiety, hysteria, and so much more.
Yeah. So I always say prior to COVID, we need to have a mental health advocate, doula, provider, our cheerleader on board prior to any adversity, right? Mm-hmm. Similar to we have a dentist, similar to a pediatrician. We don't want to wait until there's crisis to identify that person, because you have to build relationships, so on and so forth. But with COVID, I would argue that we all need to make sure that we have that person in place right now from the moment that we learn that we're pregnant. Because having a baby already is a tough road. So I can just imagine how it feels having it during this period. One of our moms, her baby has COVID, like 8-year-old. So it's just a really tough time for us who are not pregnant or not postpartum. So again, just really getting your supports in place prior to delivery.
Thank you. Anna, did you have anything you wanted to add to that? What you all have seen, or anything that you're working on around COVID and maternal mental health as we prepare to wrap up?
I have seen some studies starting to emerge, and what I've seen is, and heard is that there's been not only an increase of depression and anxiety, as you would presume, but potentially even an increase in psychosis. And so what we're looking at and wondering and just kind of getting curious about is this idea of, is it a result of the stress of the pandemic, or is it a result of the people are afraid to go get the help because of fears of contracting the illness? There's could be a lot of reasons there. But as Dr. Alexander was saying, there's still a lot of work to be done to kind of uncover what that really might be. But we are starting to see that there's been a great impact for sure.
Thank you so much. Yes, I await the data, learning more. That case that you mentioned in Florida, I've been following it as well. There is another case, and it looks like even when they took the baby, that baby ended up contracting COVID, and they knew that the other family that was carrying the foster family had been exposed. And so, again, there's so much work for us to do around this, and I'm glad for partners like you both Thank you so much, Dr. Alexandra, for being here and the work that you're doing. Continue to shine a light on this issue. Continue to address the system and make sure we make impact to make destigmatize, make structural changes around implicit bias and racism in our maternal mental health, our perinatal mental health work. Future Dr. Anna King, thank you for your presence here and for the work that you are doing as well, and all of the trainings that you're both doing. Please check in with us. We look forward to hearing from you again. We're sure to have you back. And if we have questions from our audience that for you to answer, we will definitely tap in and get that done so that we can provide the accurate response. So again, thank you, ladies, both for being here, and you are greatly appreciated, and look forward to working with you in the near future. For being here. Thank you for our speakers to taking the time to come and talk to us about Black maternal mental health, perinatal mental health. We are grateful for everyone who took the time to join the Black Doula Consortium's third webinar. Our next webinar is scheduled for September 28th. If you follow us on our social media handles, our pages, you will find the event with the agenda and information coming in the middle of September. Also, we want to thank our partners. We want to thank our Black Doula Consortium partners, the Center at Sierra Health Foundation, Blue Shield of California, Diversity Uplifts, Inc., Frontline Doulas, the Black Child Legacy Campaign, as well as the Black Wellness and Prosperity Center. I'll thank myself as well. And we just thank everyone for their work and helping us to keep raising these important topics. Again, thank you for your time. Please don't forget, in order for us to build healthy and resilient communities, we have to start with giving attention to our women and babies, attention they need and deserve. So please do that. Take the time, share this with someone, invite someone to participate and attend, and ask the questions and let us know what other topics you feel like you know that we should address, not that you feel you know that we should address and bring to the light and forefront. Have a great day, evening, week, and we look forward to seeing you soon.